Our topic for today's webinar is how to develop a trusting and fruitful relationship with students. This is a continuation from our previous discussion back in the fall. Our presenter for today's presentation is my colleague, Nettie Lucas. Nettie earned her graduate degree in nursing education with Weber State University in Ogden, Utah. Nettie taught nursing in the didactic and clinical setting with special emphasis teaching medical, surgical, and mental health nursing. Nettie specialized in the flipped classroom method of instruction, incorporating creative strategies for active learning in the classroom. Her Kaplan background goes back to teaching the NCLEX Live Review course and working closely with students while participating within the faculty chat team. I'll now turn your attention over to Nettie.
Thank you so much, Julie. Welcome, everyone. I'm Nettie, and I'm so happy to present to you the very first of our 2025 Novice Nurse Educators Series, How to Develop a Trusting and Fruitful Relationship with Students, Part 2. And as Julie had stated, Julie hosted Part 1, and she will be putting a link to that Part 1. If you were unable to attend that, you can access the recording, and the link will be in the chat. So I put a lot of work into this, and so I hope you learned something from this webinar today, because it is such a very important topic. This is a topic that I hold dear to my heart because when I was a new faculty member, I made a lot of mistakes before finally developing a trusting and fruitful relationship with my students. And I'm sure that some of you have been through the same journey I have. Maybe some of you just don't have any idea on how to make your relationship with your students better. So after today, you should be able to identify professional boundaries between faculty and students, demonstrate professional and purposeful communication with students, and demonstrate how to create a nurturing and supporting learning environment in nursing education. If you don't mind taking a moment, get your phone out, scan this, and you'll go to a survey. You will see some questions that will kind of make you think about what is appropriate and what is inappropriate. It's interesting what some faculty believe to be appropriate and inappropriate. After you're done, I will go to the results. I will not be able to post them to the screen, but I'll review them from my end and share with you what the results are. So let us know if you've all, Julie, you can see if the majority of them have done the survey so I could go to the results when ready. Let me get that QR code back there in case someone's missed it. Is everybody set? Okay, I see a thumbs up. Okay, let me go and there we go. Look at those thumbs. Look at them. They're beautiful. Healthy looking thumbs. Okay, let's go to the results. You're going to see the same screen, but I'm going to go into my results. And let's see what we got here.
Oh, Nettie.
Yeah?
Your PowerPoint presentation came off the screen.
What do you see on the screen?
We see the Zoom survey results.
Oh, you do?
Yes.
Oh, that's good. Okay. So what do you see now?
We're seeing the results of the survey.
So okay, look at this. The sports bar with your students, including a recent grad. Is this appropriate? Invited to your cohort. Look, most of you said no. Look at that. See? Now, I'm going to be totally truthful with you guys. I did that. And it turned out to be a very good event because I made it official by bringing in alumni. And I'm not condoning this. I'm just telling you my experience. Bringing in an alumni to have a discussion with my students. And my students loved it. But no beer, just pizza and beverages. Is it appropriate to visit your student when they are hospitalized for an illness? Absolutely. Look at that. Almost 50% though disagree. So there's no correct answer to this. It's how you interpret what's appropriate. And there are some that are inappropriate, but oh, look at this. Is it appropriate to loan money to your students? Now that's a gimme, right? And is it appropriate to tell your students about your personal problems? That's a gimme. Is it appropriate to accept a $100 gift card from a graduating cohort? Few of you said, yeah, why not? Okay. So that's like just a little bit of what I'm presenting with you today. But as you can see, student-faculty relationships, we're going to get into it, but it all starts with boundaries. It really does. And so as I go through this, think about what it was like when you were a student. Think about the way that you were being, that your faculty was communicating with you, because if you ever found that you had someone as a faculty member that was unapproachable, you got to really do some self-reflection after this briefing today, because maybe there's some things that you could improve on. I don't know you, but it really does affect your students. So let's get started with number one, boundaries. Setting boundaries is an essential part of developing a trusting and fruitful relationship with your students. It truly is. As faculty are developing that relationship with students, they should remind students that boundaries, such as those in nursing school, will be paid forward to their patients. Look at that bullet there. We learn about boundaries as we're in nursing school from our faculty, and that should translate to, you know what? I need to have boundaries with my patients. It's carried forward. But what about your boundaries? Have you established them yet? Do you have personal boundaries that you want to establish that maybe your institution hasn't yet? Have you established them? Are they well known by the students? Maybe they're not looking at their student handbook. Maybe you should bring it up in the very first day of class. Without boundaries, you could find yourself in some very difficult situations with your students, such as maybe being taken advantage of. If you don't have any boundaries, they might do that to you. It is up to you as faculty to set the proper tone by making sure that students are comfortable and knowing that when they show up for class, they feel safe for better learning. Having boundaries in place ensure that your students can be confident in knowing they are in an environment that allows for open and honest dialogue, support from faculty, and connectedness with the cohort. So I found these boundary violations from an article by Peters. I love this article. The references are in the back of the slideshow, so be sure to check out some of these articles. It's really informative. And these are the most common boundary violations seen in nursing programs. So let's go through them. And as I go through these boundaries, you should be asking yourself, imagine like an am I right there before each bullet. And it might make you reflect on some things. And it may be some situations you found yourself in that might have been boundary violations. Whoops, sorry about that. Am I being overly involved with my students? For instance, loaning money, that was in that survey. Forming friendships, how many of you have made friends with your students? Personal phone calls or texts. If so, it could alter the expectations that you set for your students to uphold. They may take you for granted because you became their friend, and that's just, it's not going to be so productive for them. So the solution is, rather than doing that, just be an advocate for them. And if you find that they need help from you, refer them to the support services if needed. Am I disclosing excessive personal information, like talking about your problems to the class, excessive bragging about your family? If you're doing that, you may start to feel a little disrespected, and you may even get some pity from your students. Do you want that? Also, you're wasting valuable time that belongs to the student, right? So just avoid monologues about your personal life. Keep it professional. Am I doing for rather than working with? A very good example is like at clinical, okay? And setting the infusion pump for the student rather than having them do it under your supervision. If you're doing this and you're doing the work for them, faculty are preventing the students from developing independence as well as critical thinking and problem solving skills. So your solution is to just step aside and allow the student opportunities to problem solve and be able to identify a correct course of action which promotes autonomy and accountability. Am I protecting them from consequences? This is when individual students may be asking for more time, on an assignment, allowing for late assignments or rescheduling a test due to what student feels is a valid reason. And remember what that says there, due to what the student feels. So that's a clue right there, is a valid reason that maybe they're trying to just get out of something. If you find that you've come into this situation, faculty are just not demonstrating respect for the student's responsibility as an adult learner. You have to think about that if this ever happens. Don't overprotect them. Stick to the syllabus. Treat as if this is a contract between faculty and students, and hold them accountable for incomplete or late assignments. What about worrying excessively about your students? For an example, you worry so much because the fear of being too tough on the students and accepting substandard performance could be a problem for their learning. Many faculty are driven by student evaluations because they want to be popular with the students, wanting to be liked. I was guilty of that. I'm going to be completely honest with you. I wanted to be their friend. I wanted to be liked, and I was driven by those student evaluations. Boy, did I learn a lot. So if you find that you're in this bind, there's no benefit to the student learning, and this worrying could affect them in later courses. It's just not going to help them with their learning. So what do you do about it? You need to focus on the student's performance and think about program rigor versus the student happiness. Keep everything tight and professional in nursing. They are adult learners. They can handle anything that you put before them. Am I gossiping? So when a student has a problem with another faculty member and shares with you the problem they're having because they want to seek sympathy, or maybe they're gossiping, or whatever, you just never gossip about another faculty member to students, because if you do that, this affects your team. It affects peer relationships within the faculty team. You'll have different perceptions of each other. It violates and ruins morale and esprit de corps among the faculty. So avoid gossip. And what do you do about that? You know what you should do? Don't get involved. You want to help the student. You know what the best help that you can do if they're gossiping and they have a problem with someone else? You refer them back to that person who they're having a problem with. And that faculty member will help them resolve any issues that they have. What about touching inappropriately? Am I touching inappropriately? So touching students is not like how you would touch patients in a therapeutic manner. My research, after everything I've read, is just simply avoid it. So if you've been touching students, hugs and pats, you got to be careful, because what I've been reading is that sometimes your touch could be interpreted by the student as offensive, and you won't know it. The danger is that it bothered them so much they feel unsafe in the learning environment. What if you did something that affected their learning? So before you touch, you want to give them a hug or a pat on the back, you need to ask permission before initiating that physical contact. You just want to protect everybody in this situation. So again, you're going to hear a lot of this. The learning environment must be safe. You're going to hear this throughout my entire presentation. I can't stress it enough. Do you ever have this attitude? I believe that no one else understands the student better than me. So an example of this is when a faculty believes that they're the one that can break through the student that has problems. They're the only one that can do it. If so, you must know that when you're overly protecting your student, it crosses over the personal boundary line. It's not professional, and it does affect their learning. So how do you solve this? Be your student's advocate, not their friend. Refer to academic support services for tutoring, or develop your own tutoring within the cohort. Here's the final one. I am a faculty member who believes I would never cross that professional boundaries line. So I call this, in the world of faculty, the fake it till you make it boundary, where you're just kind of clueless as to what's going on when it comes to these relationships. You're just kind of a cog wheel, like spinning and doing your thing. You may have limited insight into your own behaviors. Reflect on your teaching behavior. Eventually, it will surface through a peer review, if applicable. So work on your awareness of the boundaries and seek assistance from your peers. Participate in your own self-evaluation and be willing to change. if you notice something that maybe you need to make a pivot on. So what other boundaries have you identified that support a safe learning environment? You can share that in the chat. Boundaries that build on trusting and developing a fruitful relationship. Just think about that. So those of you who are interested in AI, I thought it would run up some AI prompts to see what AI says about boundaries. And this is what came up. Considering how AI might be used in the academic setting, I thought I would share with you a few examples of AI through this presentation. So I prompted it to say, give me some strategies on how to establish boundaries. And look what I got. I was very brief in my prompt. So prompting is important. If I wanted more information, I would have said, in a nursing clinical situation or classroom situation, and I might have even given an example of a violation of a boundary, something to get more and more information. So the more prompting you do, the better of a response you'll get. So mine's very basic and generic. To establishing boundaries, setting expectations from the beginning, professional behavior and conduct, avoiding conflicts of interest, and the benefits of having boundaries, enhanced respect and professionalism. Also, reducing the risk of favoritism and ethical issues. That's all very relevant to nursing, but I could have got more. Let's continue on to my normal presentation here, no AA right now. So how do we set boundaries? First of all, before you ask yourself how to set them, you might not even need to do that. Just look to your faculty handbook, student handbook, ask around, but I'm going to go through this and explain to you how you do that. I read this article, again, same author, Peters. According to Peters, there are 7 strategies on setting boundaries between faculty and students. But before you start setting these boundaries, always ask yourself, what boundaries would facilitate a safe learning environment for my students? Remember, safety is paramount, right? Even in the learning environment. If they don't feel safe, they're not going to learn so much. They're going to be worried. So number 1, if not doing so already, consider arranging a productive orientation for your newer faculty. How was your onboarding when you joined your team? Think about pairing newer faculty with veteran faculty to form a mentorship, as well as finding peer support. Review established boundaries for the nursing program periodically, as they may change due to technology. For example, social media changes all the time, and that affects boundaries. So always consider that when coming up with your boundaries. Now, when you're establishing or updating your boundaries, it's not such a bad idea to review the ANA Code of Ethics, which provide you with 9 provisions for nurses, which include boundaries regarding patients. You may find that this resource, as you are reviewing your program's boundaries, can be suitable for students. So they are a little different. They are, when you look at them, it's really patient focused, but there are some really good boundaries there that you can turn them over into boundaries for your students. So make sure you check that out. I thought it was very useful. What about role playing? Role playing could be helpful. For instance, if you are planning on having a difficult conversation with a student and you're not sure how to approach that conversation, I'm sure many of us have had that before. I've had it. Consider role playing it out with your peers. Seek help from your team. Run it by before you just jump into the student's presence and just go crazy on them. You really want to play it out to make sure you're addressing this correctly. And of course, I mentioned this before, boundaries should be in your faculty and student handbooks. If they're not, it's something that maybe you could talk to the dean about, including them or making sure that they're in your syllabus. Just let the students know what your expectations are, including boundaries. And overall, remember this, that bottom line right here, faculty are responsible for ensuring that students are in that safe learning environment. So we're going to talk about purposeful communication with students. Communication with students can be a bit challenging. Typically, one would expect that when we are communicating with our students, we should be professional in our delivery of information, right? But when it comes down to communicating with students, we really want to communicate with purpose. We've got a lot that we've got to share with them. So let's take a look at professional communication first. So how are you communicating with your students? Are you enthusiastic with a positive attitude? Are you able to offer constructive criticism in a respectful manner? What about approachability? Are you comfortable having one-on-one interactions with your students? Now, when I was a student, I had just one faculty member when I was in nursing school that I found was very unapproachable. She made me anxious. I was afraid of her. But yeah, it's true. There are faculty that scare students. Well, what about you? Share in the chat. Have you ever had a scary situation with your faculty? It can happen. And we never want our students to be afraid of us. I don't think it's intentional. I just think it's something that it comes natural with some people and they might need some redirection. Professional communication is the foundation. It is to developing that trusting and fruitful relationship. So, what is the solution? How do I do better at this? Role model, practice. A credible and compassionate role model can inspire humanized care in the students by engaging positively with them, being student-centered and viewing students as individual and unique. So wouldn't you agree that professional communication is most appropriate for interacting with our students? So let's look at AI real quick and see what AI says about professional communication. Key principles of professional communication: clarity and concise, respect and empathy, active listening. Boy, these are all, they just make my hair stand up on the back of my neck. These are all just so much nursing, right? Email etiquette, constructive feedback, conflict resolution. Professional communication improves student understanding and satisfaction. Stronger teacher-student relationships. Not so bad for AI, but what if I were to tell you another strategy that you may find valuable to communicating with your students if the need ever exists? There's another strategy I'm going to share with you right now. I read this very interesting article by Schwartzbeck and Tyson about considering therapeutic communication with our students and how it's effective, for it is just like it is for patients. So these are a nursing faculty. They started noticing trends of their students. Several of the students seemingly had similar presenting symptoms of sadness, anxiety, negative thoughts, depression, and stress. So they kind of recognized and they're like, huh. They tracked the symptoms that the students were collectively sharing for the most part and realized this is like working in mental health nursing. I'm not kidding. They really wanted to help nursing students and thought perhaps communicating with them like nurses do with patients, maybe it would help minimize the mental struggles that most nursing students experience in one way or fashion in nursing school. So they created the mnemonic of SANS: S, sadness, anxiety, negative thoughts, depression, stress, SANS. As nurse educators, we know there is a ton of research on nursing students with mental health problems. This is not new to us. They're human beings. We know this, right? However, Schwartz, Beck, and Tyson couldn't find much research on recognizing SANS and identifying any scriptural or therapeutic communication interventions that may minimize the symptoms their students suffer from. It was really important, or interesting, sorry. So Schwartzbeck and Tyson found in the research that when not managed appropriately, you know what could happen? And you've seen this. SANS could result in persistent tardiness, excessive absenteeism, neediness, and avoidance. They suggest that students affected with SANS may change their appearance and lack hygiene. You'll notice a significant change. There may be some inappropriate verbal or written communication with peers and faculty. There may even be some ostracism by their peers, leading to social withdrawal, and most of all, the biggest one of all, academic decline. All of these SANS symptoms that lean toward student distress need recognition and some style of communicative intervention. Based on their small study, Schwartzbeck and Tyson used therapeutic communication, and they tested it out, and here's how they did. So what they did, Schwartzbeck and Tyson, they provided a sample case and how to use therapeutic communication to mitigate the student's issues. So imagine that a student comes to you, and I'm just going to read what the authors of this article did. This is the student talking to you as faculty. I worked hard to get into this program. I failed the first test, so I'm doomed. I'm never going to get this. All I do is study. I don't go anywhere and I still failed. It's depressing and I'll never be happy again. I can't sleep and I forget to eat. I just don't get it, but everyone else does. If I'm having this much trouble, I should probably think about another major. What would you, how would you manage this through professional communication? I don't think it would be that easy speaking in a professional manner, right? This is something that truly would involve some sort of therapeutic communication. You have to have a different approach. So here are some examples for this ceremony. It's for this, I'm sorry, for this scenario on how to handle these different elements of therapeutic communication. Providing empathy. And here's a response that a faculty would give. I can see how difficult and upsetting this experience must be for you. What about active listening? I hear you saying that nursing school is challenging and you don't think you're going to be successful. Providing information with permission. Would you be interested in a list of resources that may help? What about encouragement? This is only one performance evaluation. There will be other opportunities to improve. With tutoring, enhanced study techniques, and practice, it's likely that your performance will improve. Questioning, clarifying, and confronting. Tell me what you mean by you're doomed. We need more information to clarify, right? What about confronting? You said that you want to be a nurse, but you're giving up after failing the first test? Summarizing the scenario. It sounds like your confidence is shaken. Even though you've worked hard to get to this point, you've given up a lot and you're disappointed and don't think you can't do what is required to become a nurse. In addition, you're having trouble eating and sleeping. Did I understand you accurately? So with that said, I would venture to say for a lot of us, therapeutic communication comes naturally because of our experiences as nurses using this approach with some of our patients. But it can be difficult. So think about it. If you ever find yourself in a situation, you might have to go to therapeutic communication rather than just that professional manner. You might have to go deeper. Create a nurturing and supportive learning environment. So what is a nurturing and supportive learning environment? You've heard this throughout the entire slideshow for now. So you all likely know who nurse theorist Patricia Benner is. She states, student-teacher relations should be attentive, connected, confer dignity, respect, recognition, and knowledge of students' talents, learning interests, challenges, and concerns. She states that small things like making sure you know and pronounce student names correctly and giving students an opportunity to introduce themselves that communicate interest and care. Icebreakers, small conversation starters, such as what song describes your first day of clinical? I keep thinking of James Brown when I hear this. I feel good. Do 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 do. All right, that would be a good clinical one, right? What about Highway to the Danger Zone by Kenny Loggins? That would be appropriate for clinical. I was just being silly, but to continue on, Benner recommends that faculty ask lighthearted questions that spark personal reflection in pair share or small group conversations to get students talking about themselves. Now, on the next slide, I'm going to provide you with kind of like what the first day of class ideas would be to help you learn how to set that tone in conducting a safe and nurturing learning environment for your students. So start it off with a welcome email, 1 to 2 weeks prior, including a schedule, location, agenda for the first day. Start class with greetings, student brief introduction. Don't forget those name tags, the folded tents, right? Learn the names quickly. I have problems memorizing everything, and as I get a little bit older here. And so they offer an idea, which is a really good idea, with getting a digital photo on your rosters if possible. You might even have it already in Canvas or whatever teaching platform that you're using. But that really helps you get familiar with faces and names. Make sure that you're sharing your philosophy, your teaching philosophy, the syllabus, and your expectations. I was a big expectations person. I made sure I made that known to my students. And then setting discussion norms. This is to maintain civility when we have some discussions. The next slide is going to show you some discussion norms in class that you'll find beneficial. So these discussion norms, you really should set these because in nursing, we are unique in that we're exposed to all sorts of tragedy, pain, and discomfort, right? When we're on the floor. We've all seen it all. So it's unavoidable to have such discussions in the classroom, sharing our experiences with students because we learn from them. And in order to make use of these discussions, they must be purposeful and regulated by some sort of protocol, right? And that starts with you, the faculty, you drive it. Be the moderator and keep the flow of the dialogue at a very professional level. If the discussion goes off track, bring them back in. Also remind students the importance of civility because a lot of nursing cases discussed could stir up some emotions and differing points of view. This happened to me when I was teaching and we were talking about euthanasia. Boy, that's a big one, right? So you've got to be able to keep control of the group and the discussion. Role modeling, quality facilitation of any discussion will earn you some respect from your students, and it will make that experience a valuable one in class. I want to talk about Benner's writing on safe and generative learning environment. I'm telling you, you're going to come away from this and all you're going to think about is a safe learning environment. We use it a lot. So Benner states a safe and generative learning environment refers to a space where learners feel physically and emotionally secure enough to actively participate, take risks, explore new ideas, and contribute meaningfully to their learning process, fostering creativity, critical thinking, and personal growth without fear of judgment or reprisal. Benner describes each of the 4 characteristics that create a safe and generative learning environment of safety, where, faculty must avoid censure, blame and shame. Students must feel safe to fail. Assign a trusted nurse educator or learning specialist to observe your teaching and assess the learning climate your relational teaching style creates for students. Avoiding censure is a big one. Let your students talk. Sometimes I had one, you might have one too, where you have a student who is overly energetic and raises their hand all the time. Now, if it gets to be kind of disturbing to the class, then you set that student aside for a private meeting and talk about it with them. I had to do that. I had a chatty Kathy, but I didn't want to shut her up. I didn't want her to feel like I was censoring her. But we did have to talk about maybe letting other students participate a little bit more. And it worked out. She was fine. I ended up working with her. She worked at my clinic. What about engagement? Essential, engaged learning community increases student to student learning. Getting those students to work together, they learn better. Beware of cognitive overload. It interferes with rationality and thinking. It also creates anxiety for both the student and the faculty. Connectedness. So learning is enhanced and increased through peer learning. We know this. Some of you are already participating in group learning projects, discussions and sharing of experiential learning from clinical simulations and actual clinical practice are other strategies for making courses highly interactive and form that connectedness among the cohort. Support. Support's huge in that generative learning environment, safety. What you need to do is enlist campus level of assistance and resources for those with learning difficulties and encourage an open, inquiry-oriented learning climate. AI says, in asking the question, how to create a nurturing and supportive learning environment, that's the prompt I used. The importance of a supportive learning environment enhances student well-being and learning, promotes academic success and retention. Then they give us some strategies to create a nurturing environment, encouraging collaboration and peer support. It's just like what I got from my article. Providing resources and support services, fostering inclusivity and respect, increase student engagement and motivation, positive impact, outcome, satisfaction. See how valuable AI can be helpful to you. You just got to make sure that you're checking the resources and validating if you want to use it. In conclusion, I hope you found great value in this presentation today and that you tried to implement some of these strategies to create a faculty-student relationship that encourages a more engaging, trustful, and safe learning environment. Now, we reviewed boundaries and violations. We went through professional communication and how different it is from therapeutic communication. Lastly, I discussed several strategies in creating a nurturing and supporting learning environment to include setting the tone, being a role model by demonstrating a supportive and nurturing relationship with your students, to include safety, engagement, connectedness, and support. Here are my references. If you ever need to go back to them, this will be recorded and you'll be able to refer to them. Do we have any questions?
Such great information. Thank you, Nettie. Excellent. We did have a really good question, and I didn't answer it in the chat. It was from Tara. And Tara is asking a question about how do you close the generation gap between a Gen X person and a student? And then Tara also included, I'm not an emoji person.
Oh, that's okay. So let's talk about this generation gap. This is a huge, there was nothing addressed in my research about generation gaps, but I can tell you from personal experience because I I had students that were my age, but there are generation gaps. And basically, what you have to do is get them to work together. I don't think you can change the attitudes of the different generations, but you can find some activities that they will all enjoy as adult learners to get to know each other a little bit better. If you find this is disturbing in the classroom setting and you're teaching and there's discussions because and there's problems with generations, it's something that you need to just address individually with the students if they feel like it's bothersome. But I've never seen a case where generation gaps affect any other students' learning. But if you're talking about how to get them to get along because there's generational gaps, you have to find something that they both agree that would be helpful in their learning. It's all about how you're teaching in the classroom and them getting to know each other in filling in those gaps with learning about each other and understanding how the generations work. I did talk to my students about generational nursing because on the floor, as you know, we have veteran nurses and then we have the brand new nurses, and they all have to work together to get along. And I would talk to that about students, how we all think a little bit differently. And I think when we educate them on generational nursing, it really helps them understand where the other person is coming from. So I would just refer them to understanding what that is and how the boomers would respond to a certain situation versus a Gen X. That's a huge topic in nursing. That's a good question.
Yeah, fabulous question, Tara. And I'll just add that you, as an instructor, be authentic to yourself. Don't try to change who you are. If you don't like emojis, then you don't like emojis. That's okay. I love how Amanda chimed in into the chat too to give some of that, and I think that's what Amanda was saying as well. Is if you don't like emojis and you don't want your students using it because you don't think that's professional behavior, that's part of your standards. That's part of your expectations. So put that in your syllabi. Um, don't try to conform to a different generation, but show students, as Nettie has said, appreciate all the different generations and how we can learn. And as Nettie perfectly stated, we have to work together across generations. So how can we do that? I would also invite you to ask your students, related to generation, not necessarily, that specific question, but ask them what helps them to engage or what activities help them feel comfortable. And then maybe that's something that you can incorporate into your own learning activity that kind of connects with them a little bit better. But stay
Yeah.
true to who you are. Don't change who you are because you're trying to connect with a different generation.
Yeah. And to add to that, you could actually learn a lot from the other generations just by asking them questions and getting to know them. And it might be, you might, some of the older, like on the floor, some of the older nurses have a hard time with younger ones being the charge nurse. But, if I was an older nurse and there was a younger one, it just depends on who the person is. Always, like what Julie said, stick to who you are. Uh, you have discussions and you learn from them like they would learn from you. I think it's just something that everybody's going to be confronted with throughout their life in any regard, not only nursing.
And Nettie, Tara makes a great point. She additionally put in, I'm finding in clinical, when we text and I don't use emojis, they think I'm mad. So
Oh,
that's a great point. You know, that's great for you to really, excuse me. I've had some of these allergies the last couple of days, so I apologize for that. But that's really a great link for you all to connect so you can provide understanding. If you're not responding at because you're not using emoji, you just don't use emojis. And so that way they don't feel like, that you are mad. So that's a great opportunity for you to open up a discussion.
yeah. You don't have to use emojis. Just tell them. And if you're interested in learning about emojis, ask one of them to share it with you. Anything else? Okay, well, I think that might be ending our session today. Make sure that you look on your faculty site for any future webinars coming up and go back to part 1 of this webinar. And if there's anything else, I think we can end this.
Yeah, Nettie, I don't see any other questions in the chat. I did put the link to the evaluation survey. Remember, when you fill out that survey, you will get a certification of attendance. So please take that time to fill that out so you get that certification. Within 48 hours, the presentation recording and the slides will be available. Thank you all for attending. We appreciate your time.
Thank you.